30 hertz straight up.
Hello, you guys. Thank you for tuning in to another wonderful episode of Lupus Has No Face podcast with your wonderful host, Savannah, and our lovely guest, Erica Nicole.
Yes.
We will be discussing the double diagnosis, individual illnesses, and infertility. That's a big one, right?
It's a huge one.
That's a big one.
It's a big one.
Before we dive right into it, right? Because that's a huge one. So let's tell the people who is Erica Nicole. I love is that literally like your first and last name?
It's my first and middle name. Yeah.
I love the ring on that. I was like Erica Nicole.
Yeah. Shout out to my
ring on that.
parents.
They did a good job. They got
They
a
did a
bell
good
ring on that
job.
one. Erica Nicole.
Yeah.
So who is the Erica Nicole?
Yeah. Oh, that's a huge question.
Ooh.
Let's see. I am a Milwaukee native, born and raised. I am a licensed psychologist. So in the professional realm, I am known as Dr. Erica Mckinney, affectionately known as Dr. E. So
put some respect on that name.
T-A, Doctor, not Doctor, Dr. E. I am a sister and a granddaughter and a daughter and a lover of all things animal, and I like to travel, and I love God. I'm really passionate about serving the Milwaukee community, serving women who look like me. So yeah, that's who Erica Nicole is.
That was a lot, and just in a little nutshell. You gave us just a little bit, but like, let us touch on this and let us touch on that.
Yep.
Okay, so what brought you into the medical field?
So actually, I had no intentions in being in healthcare.
Really?
Nope. So as I mentioned, I love animals. Have loved animals since a kid. So my actual plan was to be a veterinarian.
My daughter wanted to do that.
I wanted to be a veterinarian, and got to that first semester of undergrad where you had to take that math class to see how you. And I was like, all right, no, that I can't do that. So I was like, I can't be no veterinarian. And so then I started kind of just taking classes here and there, African-American study classes, social work classes, sociology classes. And so I landed in kind of social work sociology because I knew I wanted to help people since I couldn't help the animals. So then So then right after undergrad, I went right to get my master's degree in clinical mental health counseling with a specialty in addictions. So even at that point, I didn't know I was going to end up in healthcare. But a part of my master's program is you have to do like an internship. Mm-hmm. And so I actually did my internship in a health setting, working with individuals who were living with HIV, AIDS, and other medical conditions and mental health conditions. So that was actually my first introduction to healthcare.
Oh, wow.
It kind of happened on
accident.
You
in.
Just kind of jumped in. And I was like, wow, I really like that. And so then I worked for 4 years as a therapist here in Milwaukee. And in my different kind of settings, like I worked in corrections and nonprofit and community mental health. And I ended up working in voc rehab, helping people who have disabilities get a job. And a lot of the people I saw had medical conditions, they had mental health conditions, they had both. But it seemed like if we didn't deal with both, people weren't able to move forward. And so it really started to like dawn on me like, oh, I need to go back and get some more training. And so I wanted to get more training in mental health with a specialty in health psychology. So that's kind of how I ended up in healthcare. It was
Oh
not
my
planned,
God.
just kind of happened.
So I want to go back to the system, right?
Yep.
Because the system can be very tricky. So when
Yeah.
you say the system, you're talking about incarceration, correct?
Mm-hmm.
How is it there when the inmates
Mm-hmm.
need healthcare?
Yeah.
And I'm asking because I was told that some people don't get their medications in there.
Mm-hmm.
They have to be in there a certain amount of time to even get it. Sometimes they never get it.
Yeah.
Sometimes the COs think they're lying, so they don't send them down. So,
Yeah.
like, what is that like? Like, how do you break that bridge?
Yeah. So I was in corrections, oh my, 13, 14 years. It was a while ago, and I was a therapist. But what I can tell you is that the the prison system in itself is overpopulated. So there's not enough staff to oftentimes serve the people who are incarcerated. And that goes from CEOs, social workers, therapists, healthcare workers as well. And so, one thing that I consistently saw while being in corrections is the number one priority is security, physical security.
That's the number one
That's
priority.
that's the number one priority is keeping the inmates safe, keeping staff safe. So if there's a security concern, that can kind of shut down the flow and motion of the facility at that time, which unfortunately can mean people may not be able to get up to the health system or to the doctor, or their medications may not be dispensed at the time they're supposed to be dispensed if there's like a security concern.
I don't want to spend too much time on this, but
Yeah.
boy, I do want to talk about it. But we're not going to do it today. I just got one more question to ask.
Yeah.
So, as a doctor, as a nurse, you take an oath, right?
Mhm.
So, with that being said, you saying security is the number one,
Mhm.
but doctors, nurses, they
Mhm.
have an oath to serve.
Mhm.
So, how does that work when you're not abiding by the oath?
Yeah. So it can be a tricky kind of ethical dilemma. I think that's what you're kind of
Yes.
getting to. And so I can only use like an example for me as a
Okay.
therapist. So there have been times where I was getting ready to do my groups and there was a security issue. The facility locks down. You can't come out your office. The inmates have to go into their to their dormitories or to wherever their housing units. There's no movement. Like it's a hard stop. I know it's a challenging concept to wrap your mind around, but literally, if the facility has to shut down for any reason, it's shut down. Even if it's 4:30 and it's time for you to go, if there's a security threat, the facility is shut down. You can't leave until that security concern is addressed.
I get that, right?
Mm-hmm.
I do. But on the other hand, I feel like it should be something in place because you have people there with HIV, you have cancer
Yeah,
patients, and all these serious
absolutely.
illnesses. So it should be something in place to something was to happen
Yeah,
that they can attend to the inmates.
absolutely. I mean, I would assume that there probably are now things in place that I'm not privy of because I'm not in that system anymore. But like I said, I can only speak to kind of what I experienced like over a decade ago. Is that if we gotta shut
Child.
down, we gotta shut down.
Yeah, you coming back because that's a whole topic within itself. Lord have mercy. Like,
Yeah, it's a lot.
oh my God.
Yeah, it's a lot.
Okay, so let's get back on topic.
Okay.
Okay, so we are talking about the double diagnosis with autoimmune
Yeah.
and infertility.
Yeah.
So for the people I know, but do you want to explain what's the difference between infertility and fertility is?
Sure. So infertility in itself is the difficulty with conceiving naturally. That's kind of the definition. For me in my practice, I oftentimes don't use the word infertility because I feel like it has such a negative connotation.
Okay,
I prefer to use the word fertility evaluation and treatment.
sound nicer.
Um,
It does.
yeah, and it kind of takes some of that stigma away from it
Mhm.
when someone is diagnosed with a fertility diagnosis. I think just kind of in common language, right? It's like, oh, infertility, infertility, infertility. But the longer that I've been doing this work, I consistently reminded that there's power in words.
I definitely believe that.
And so for me, like again, in my practice, I feel like saying fertility, it gives my patients some of the power back. And it takes away that shame and that stigma around difficulty conceiving naturally. Or if I have to talk about infertility, that's what I'll say: difficulty conceiving naturally. And there can be many reasons as to why someone has a hard time conceiving naturally.
Like, for instance,
so there can be explained infertility, meaning someone has a medical diagnosis that they have linked to someone's difficulty conceiving, like diminished ovarian reserve. So that is when the quantity of eggs that a woman has is reduced. So as women, we're born with all the eggs that we will ever have. And over time, those eggs decrease, right? And it can get to a point where in your age, and it's not necessarily your chronological age either, because you can have diminished ovarian reserve at an earlier age. But that can be a infertility diagnosis. When we look at infertility diagnosis, they kind of categorize it in two ways. There's female infertility, and then there's male infertility. We oftentimes talk about female infertility
all the time.
We don't really talk about male infertility. That's probably a whole nother podcast. We could talk about the stigma around genders and infertility, fertility treatment, and evaluation. So as I mentioned, so someone may have like diminished ovarian reserve. Other fertility diagnosis that people probably commonly hear about are fibroids.
Yes.
Which is very prevalent in the Black community for females. There can be fertility loss due to medical treatments, certain medications, or certain medical interventions, such as if someone has cancer and they're going through radiation or chemotherapy, that can impact a woman's ability to conceive naturally, or surgery. So if someone has to have one of their fallopian tubes removed or both of their fallopian tubes removed, if somebody has to have a hysterectomy, all of those things can fall under that umbrella of infertility.
What's so crazy is that when you said we were born with all the eggs that we will ever have, and when I was looking into it and reading, I did not personally know that. So, and I did not personally know the things that we do in our life basically will kill the eggs as we go.
It can
I did not know that.
Yes, it can.
And I don't think a lot of people do not. That's not something you're being taught.
No, you're not. And I can say that even from my own experience going through, K through 12, like everybody else, getting a 4-year undergraduate degree, a 2-year master's degree, a 5-year PhD, plus a residency and a fellowship. I don't remember much around our reproductive system. I do remember, now probably aging myself, we used to have like the health like the health class, but it was more so of a conversation of like, don't have sex, because if you have sex, you go get pregnant. If you get pregnant, you go ruin your life. Type of conversation. But it wasn't really around reproductive systems. And I can tell you, in my practice, there are a lot of people, women and men, who don't understand the reproductive system at all. And then they come to me and they're like, oh, so an egg is an embryo? No. They're like, what you mean? Right? Like, no, it's different. And so a lot of my work too is literally educating people on these basic things, because people don't know it. People don't know, as you mentioned, that there are lifestyle things that you can be doing that can impact your fertility. For men, smoking weed can significantly impact your sperm. It can lead to difficulty.
I heard that, man.
Listen, we listen and we don't judge. It can. Alcohol, tobacco use, nicotine use, heavy substance use, poor nutrition, all of those things.
And I was just gonna say, like, if we have known, I'm gonna put myself in the mix. If we have known, I think a lot of us wouldn't do the things that we do until at least after we have a child. But the fact that, and I only was privileged to know because I had anatomy. You know what I'm
Yeah.
saying? I went to school for that, so I
Yeah.
knew some.
Yep.
But if it wasn't for that, I wouldn't have never knew anything.
Yeah. I mean, it's that saying, if you know better, you do better.
Yeah, and it's like too, like, you can't even really say that in that, because it's like who you're around.
Yeah.
You know what I'm saying? Like
Mhm.
who your friends and what you're engaging in. Because if you're not engaging in anyone that's in the medical field or
Yeah.
having those type of discussions, you would never know
Unless you just start doing research, or
on your own. Yeah.
you hear conversations. What I love about what's happening in our communities now, like I look at like the Jennifer Hudson show and all of those shows,
Mhm.
they're starting to talk about things that need to be talked about.
Oh yeah, for sure.
And so I'm grateful for that. But
Tamara, I think that's her name, right?
Tamar Hall,
Okay, yeah,
Tamara
yeah, yeah.
Hall, right? They're starting to have these conversations. I remember Tamara Hall did a kind of a special on endometriosis,
Yeah.
which is also a very painful reproductive diagnosis that can cause difficulty conceiving naturally. And it was just so powerful, and it actually brought me to tears to see that we are now talking about these things in a public way, because so many people are suffering from these fertility experiences, but don't know what to call it, don't know what to do, don't know where to go, don't know who to talk to about it.
Because it's almost like you have a sexually transmitted disease,
Mhm.
and it's on a hush.
Yep.
So if it's not in your face,
Mhm.
then it's like, am I the only one that's going through it? Who do
Yeah.
I talk to? Am I
Yep.
embarrassed? Did I do it? You know what I'm saying? So I'm thankful that they are
Yeah.
starting to catch up
Yeah.
what people been dealing with over decades, because
Mhm.
this is not new.
It's not new. It's not new. Some of my work is working with people who are using like donor egg, donor sperm, doing IVF, IUI. That's been going on since the 80s.
And see, I probably just heard about it like maybe in college.
Mhm. This is something that's like, these are medical interventions that have been going on since the 80s.
And then too, with the working women, or the women that work so much and want to get their career together and have everything set up before they actually had that child.
Yeah.
Now, if they knew,
Mhm.
they have the options to freeze their eggs,
Yes,
so
they do.
they can have a child
Yep.
when they're ready.
Yep. We call that fertility preservation. Literally. And I see a lot of women who come to me to kind of discuss if that's the direction they want to go.
That's amazing.
Mhm.
That's so amazing.
Mhm.
We're gonna get into a couple of these questions
Yeah.
here. My iPad just did what it wanted to do. Okay. To what extent does the emotional stress of managing an autoimmune disease,
Mhm.
and anxiety, depression often experienced during infertility?
Yeah. So a lot of my research has looked at this. So when someone has one diagnosis, it can be challenging in itself to just manage that one. But when you look at something like lupus, an autoimmune disease in which your body is literally working against itself, you can have symptoms that flare up unexpectedly, that flare up and don't go away. You're taking medications that have nasty side effects oftentimes. It impacts your energy level. And whenever you're physically not feeling well, there's a direct connection to your emotional wellness. So I always explain to patients in this way. If you've ever had COVID or ever had the flu before, you probably was sad, irritated, angry, anxious, annoyed at some point, right?
Yes.
And so I always encourage people to think about, now imagine if you had COVID for 6 months straight.
That is not quality of life.
But when you look at an autoimmune disorder, that's a chronic medical condition. That is something that persists for more than 6 months.
Absolutely.
6 months, 6 months or more. And so you just think about, if you're not feeling well for 6 months, you're going to be, your mood's going to be impacted.
Absolutely.
Okay. So we have this one diagnosis that you're dealing with. And so then you have this autoimmune disorder that can directly impact your ability to conceive naturally. So not only do you have your specialty appointments with either neurology or rheumatology or whoever your primary care
If not
provider,
all.
if not all, and everything, right, and everybody in between. So you're managing those appointments on your day to day. You're managing all the medications. You're probably doing some holistic things as well to manage those symptoms. Then you are trying to conceive. So oftentimes people are trying to conceive for at least 1 year before they present to a fertility clinic.
Okay.
So actively trying to conceive for a year. And then that's usually when people will present to a fertility clinic, or that's when they go to their OB/GYN doctor. So their lady doctor, they woman doctor. And then the doctor then probably starts running some tests, maybe will give you a diagnosis related to fertility. So maybe you have fibroids, maybe you have endometriosis, maybe you have PCOS.
Sorry.
No problem. The challenge with those diagnoses are there diagnoses of a rule out. So they kind of got to go through every possible thing that could be causing your symptoms before you get potentially to a fertility diagnosis.
So probably another year.
Sure. Or if you have to have your fibroids removed, that's often a very painful surgery. So as you're kind of going through these treatments, you're emotionally, right, kind of racking your brain, trying to think about, do I want to try this birth control or try this medication? Do I want to try these hormones? Do I want to try this, try that, right? All this is happening while your autoimmune disorder is still very present. So now your OB/GYN doctor, they're only able to treat the difficulty conceiving so much. So after they've probably tried birth control or hormone treatments, removing fibroids, that's when they'll refer you to like one of my colleagues. And we call those people reproductive endocrinologists. So those are medical providers who specialize in diagnosing and treating infertility or fertility diagnosis.
Just listen. First of all, I would like to just hats off to you, because the way you explain it, a kid will get it. So the way you explain it is so excellent. Like it's excellent. You're welcome. And just to touch on a little bit of my story, I was told not to have kids. Like they refrained, that they didn't want me to have. That was a big no.
Sure. Yeah.
But I did what I wanted to do. I did. We planned them and got off the medication that we need, because if you're still on medication while you can trying to conceive, other things can happen to the baby. So you got to be off the medication for a certain amount of time. So we did all of that. Now I can actually say my pregnancies were amazing. Like I had the best pregnancies ever. Good. But after I had my child, like I was so sick. Like giving birth put so much strain on my body. It was ridiculous.
It is. I always tell my patients that having a child is a form of trauma.
It is.
If you just even look at how a woman's body or a birthing person's body is changed over those 9 months, your organs are literally reorganized. Right? Like your kidneys is not where they were before you had the baby. Your liver not where it was, right? Your body literally does not become your own from the moment that you conceive. And then you either have to push the child out. So that's a form of trauma. Or you have a C-section where they are cutting through multiple layers of your skin, pulling your skin back and grabbing that baby out and then sewing you back up. So that even if you don't have an autoimmune disorder, even if you don't have anxiety, even if you don't have depression, that's a lot to happen in 9 months.
Even for a healthy person.
Even for a healthy person who has had a healthy pregnancy.
Just hearing you talk about it, it's like, oh my God, I can't believe I went through all of that.
Right? Oh my goodness.
Oh my God. So question, do you know why when people have C-sections, they got to continue to have C-sections and can't have it vaginally?
So I'm not a physician, but what I can kind of tell you generally what I understand is that so you can have C-sections for numerous reasons. It can be because like your child's like heart rate may have dropped. There can just be a variable of reasons why. And my understanding is the reason why the C-section is needed will oftentimes inform if future C-sections are needed.
Okay, so I didn't have that. I was just like, people was just like, well, once you have it, you always got to have it. And I never did my research. And I'm like, but why?
Yeah, sometimes like if someone has a fibroid that is in like can be an obstruction during the vaginal delivery, they may like have to do a C-section and they may be able to remove that fibroid. But the thing is, fibroids can grow back.
Yeah. And I do know too. I watched something on TV when this
Mhm.
lady had a STD,
Mhm.
and they didn't want the baby to go through, so
Correct.
they gave her a C-section.
Correct. So if you are having an active herpes outbreak
Mm-hmm.
in your
That's
vaginal
exactly what it
area,
was.
yep, they will do a planned C-section.
I was watching that. I was like, "Oh my god!"
Yeah.
At first, I thought they was gonna let the baby come through because they
Mm-mm.
was treating her, giving her all these type of medications like every couple of hours.
Mm-hmm.
But no, they treated her down there so many
Mm-hmm.
times, and then still the
Yeah.
baby, she got a C-section.
Yeah. Yep. Because it can infect the baby's like eyes, and it can go really bad really quickly.
That is so
Mm-hmm.
crazy.
Mm-hmm.
Lord Jesus. Okay. How can healthcare providers effectively communicate the complex interplay between autoimmune diseases and fertility to patients?
Ooh. So healthcare is science,
It
right?
is.
And so I have a lot of amazing colleagues who have modeled how to do this well. It- it's an art, okay, communicating the impact of fertility in a medical diagnosis. It's an art. You got to blend it with science, and you got to put some humanity on it. That's how I think about it. Right? So you got to give the facts, right?
Yeah.
You have to what we call inform, right? So a patient can make an an informed decision, right, with all the information that they have. But equally, it's important to still remember the humanity in it and knowing that just one medical diagnosis can really kind of push somebody over the edge from an emotional standpoint. But then when you add on another diagnosis, particularly something like fertility, which is incredibly stigmatized in our society across, and I've seen this across race, across age, across economic status, across religions, that we also as providers have to make sure that we are checking in with our patients to seeing how they're doing emotionally,
Mm.
as simple as how are you coping with this. And if a patient is saying I'm having a really hard time, then you refer that patient to somebody like me, Dr. E.
Okay, Dr. E. So, question. Have you seen any patients get pushed over the edge? And if so, like, what does that look like?
Ooh, everybody has a crash out point.
They do.
I mean, everybody has a crash out point. And that can look really different depending on someone's history, what their current situation is. Um, I mean, it's yes, I've seen people crash out.
Were you like, did you fear for your life? Like, did you, or they was just
Yeah,
yelling?
no, the crash outs usually aren't directed towards me.
Okay.
I usually hear about the crash out or I witness the crash out in my session with them because they're talking to me about their frustrations. But I always tell my patients, and this is just who I am as a person, when you come in to see me, it's a safe place.
Mm-hmm.
And so if you feel like you need to crash out, I literally tell my patients, okay, I'm not gonna tell you not to crash out, but can we find a way for you to crash out with the minimal amount of consequences? Right. And so, like, sometimes I'll have patients who are really, really upset with their medical provider for reasons that I may or may not agree with, that they're upset. But I'm like, okay, so you're upset about maybe your IVF cycle didn't go the way you planned, or you thought you had an appointment, they had to whatever the issue may be. Well, let's talk about how you can assertively communicate that to your provider.
And your voices sound like real calming. So, do
Yeah.
they normally take to your voice? Because I would take to your voice.
Yeah. And if they don't, I, I have I work with some amazing individuals, like my patients are just very dynamic individuals. And I respect them and I give them respect and I hold them in a high regard because I see them and I see their humanity. And I think with my approach, it's reciprocal.
Okay.
To the point where like my patients don't even always call me Dr. E or Dr. Mckinney. Someone saw a patient in the hallway today. Hey, Erica. I was like, hey, and went on about
Dang.
my business. Right. It's like, you don't have to call me a doctor. I know I'm a doctor. I'm a doctor. What can I do to serve you today? What can I do to help you? Um, So I think because I approach my patients like that, if they getting ready to go to that other way, I'm like, hey, let's come on back, because we don't do that over here. Not in my office. Now you may do that with, whoever else, but we don't do that. This is a safe place. We don't do that here.
That's amazing. That's dope. That's dope that they can take to you and calm down and think twice. Like, because you do have that calm and
Or
soothing type
think
of
4
way.
times, 5 times. Bring it on back.
Breathe.
Breathe.
Okay.
Take a deep breath.
You said something about age, right? So for me, I believe that older women shouldn't have babies.
Really?
Just because of what I've learned, and because I feel like if you're like 50, right? Y'all, please don't come for me.
Like, you gotta tell me what you consider, like what you consider to be old.
So I feel like if you're 60, right? 50,
Okay.
60 years old.
Okay.
And you're having a baby.
Okay.
Your child is not really going to even be able to experience you, or you're not going to even really be able to experience that child probably in a healthy manner, that child growing up. And you might get taken away before that child can even, 20 years old.
Sure.
So to me, I don't agree with that, but that's just my own personal opinion. Like, you want to have a child and the child doesn't experience you all the way, or you doesn't experience the child all the way. Or formalities.
Yeah, I hear you.
Those are the two.
Yeah.
That I don't agree as to why they should have. So is that like true?
So one, let's go back to the science of it, right? So as we get older, right, our ovarian reserve diminishes. So the number of eggs that we have diminish. So it might be hard for somebody 50 or 60 to naturally get pregnant without like an IVF cycle, like IVF, IUI, or any other type of intervention.
Okay.
Maybe not. But what the research is actually showing is that folks who enter parenthood later in life, so not in the 50s, but more so late 30s, early 40s, mid 40s, they actually have a more positive experience with parenthood and parenting and rearing their child. So you think about, I can speak for myself. Who I was at 20 is not who I am now.
Most definitely not.
And I don't have children, but I think about if I had a child at 20 versus I have a child now, that child would have a very different life because I'm a very different person in every way, shape, or form, for better or for worse. And so what we're actually seeing is it actually is a if you have a baby in your late 30s, 40s, you probably done did everything you wanted to do.
Yeah.
You done did the career thing, the school thing, you've got yourself established. What literature also shows is that even marrying later, people are more satisfied.
I agree with you with that one.
Because you know who you are, you know who you ain't, you know what you like, you know what you don't like, you know what your non-negotiables are. You're just in a better place holistically. Also what they're seeing, is for people who have children later, they recognize that they're older and they got to take their health more serious.
So the kids or the parents?
The parent.
Okay. Really?
Yeah.
Okay.
So if you got somebody who's never had kids, they're 39, 40, they likely have been mentally, right, and physically, structurally doing things to get themselves prepared for parenthood, if that's something they desire. That includes their health.
Okay. Because typically I don't think of it when they do that. I just like most people are like, they want to have their life together. You know what I mean?
We ain't gonna never have our lives together fully.
That's what I say. Like, I go back and forth with my friend. Like, you can never be prepared to have a child. Yes. She goes back and forth with me, and I have two. And I'm like, there's no way you can be a billionaire. You can have everything today and lose it all tomorrow. So you can never be ready for a child. You just go along with what you're going along with.
It's a lifelong marathon of learning. That's what I tell
it is.
Because you don't know what child you go get.
And
you can read every book.
Man, listen.
You can go to the therapist. You can go to your preacher. You can go and touch the grass. You can go lay in the ocean. You don't know the child you're gonna get. Now, I do believe you go get the child that you should have. You go get the child you should have. But there's no way to prepare for that.
I'm just laughing because people personalities, like they can have their mom is good, the dad is good, but your child is horrible. Like, where in the world? And so that's where I don't agree when like society try to place blame on the parents.
Yeah.
It don't be the parents oftentimes, right? This child has to deal with the home, school,
The environment,
their mind, the environment, who they trying to fit in with. Like, so people always be like, if the mother's and the daddy, no, that's not it. You can bring your child up perfect, and your child can be a heroin addict. You know what I'm saying? So it is. I feel like the later on in life, like these 2000 kids, I don't know what's in the water. But I just feel like this is difference in a century when you have your child, how your child is going to be. I really do believe that the environment and the years have something to do with how your child is developing.
Absolutely. I mean, I am not a child psychologist. My specialty is adults, but I just even like reflecting on my childhood here in Milwaukee, in teenagehood, the children now are exposed to things that I could not even imagine being exposed to. Like, I think about substance use. So that's one of my specialties as well. And in high school there were a few kids who maybe used marijuana, but that was it. Now you got kids using illicit substances, cocaine and ecstasy, like heroin, cocaine.
They trying everything. And I truly believe it's the adults, because back in our day, right, other parents was able to tell us what to do. Other adults was able to tell us what to do, and we were scared. Nobody wants to get in trouble. Nothing of that, right?
No.
Still to this day, I do not cuss around my elders. I just don't do it. And I started cussing later on in life. And when I did start cussing, people knew I was upset and mad. So now today's adults, what's wrong with weed? It's a part of the earth. Like, you saying this to a child, like, what is wrong with you? You know what I'm saying? So adults is projecting on the kids. And I'm just like, how do you think it's really okay to tell a child that? The answer is no. If you're not old enough to go to the dispensary, you can't have it. You're not old enough to go to the liquor store, you can't have it.
We are desensitized as a society. It's just things that we hear about now and see about now, and we don't blink an eye to it.
No, you're right. But it'd be like parents is drinking with the kids. Like, how are you drinking and smoking with your child? I would never. You better be getting married before I have a drink with you, or graduating from college or something like that. It better be something, because we are not drinking together. What?
It's so funny that you say that, because I am like so grown. Like, I'm real grown. Hey, parents, I think they listening to, at least I think my mom is. And it probably was in the past maybe 3 or 4 years that I now will like bring an adult something to my parents' house and like set it somewhere publicly and go back and forth and get it. I used to be hiding it. I'm so grown. It's because it's that respect that you have for your parents. And now I still kind of, I don't know. I do it, but I think I still feel a little bit kind of.
Yeah, like
maybe if it's letting my hair down. I bring the wine around, but some of the other stuff, I'm like, I'll tell my younger siblings, like, can you like put that Crown bottle under the like, but why? I'm like, because mom and dad can see that.
They do not care. Like, and then my sister raised me. My sister, my dad raised me, right? Okay. And we're like 8-9 years apart.
Okay.
I don't like when she tries to like talk about certain things to me, like sexual or anything. I kind of be like taken back, like, no, like, I'm respecting you this long. We cannot have this conversation. Like, oh no. So it's like I would never. But these kids nowadays, they cuss and do all this type of stuff, and it's just like,
I know.
Who? It ain't even who raised you. Like, what is your thought process?
I know. It's rough.
We done got onto a whole other topic before we get back on track. That's okay. I normally let my guests read. So if you could read the first comment.
Let's see. Thank you. Oh no, not that one. What up? That's the first one.
Oh yeah, what up? What
True.
up?
What up? True. I believe 30s is the best age to have children.
Why is that? DBS, right?
Yeah,
Okay.
DBS nails. And then we can't shelter our children forever, but we can do the best that we can. That's true. That's true. You instill those values, and you instill them, and you have to trust that those values will be their compass.
You know, that is true. So I don't really like public like what my life is just like the people. But like my kids were very sheltered.
Mm-hmm.
Um But then my mind changed as I grew. So it went from not having them see certain things
Sure.
to no, I want you to see certain things. So
Sure.
you have the mindset to walk away
Yeah.
or not to indulge in it or, not to follow the leader. You
Right.
know what I'm saying? So I'm like, so I went from sheltering to like, no, you need to see this. It's okay to have a friend that's different from you, but
Yeah.
understand what they bring along with that and understand when it's time to go. You know what I'm saying?
Yeah.
Understand you need to be true to yourself and have
Yep.
values and morals and respect. Never let those down because
Yep.
even those drug dealers or those party girls, they're going to respect you if you respect yourself.
Absolutely.
So I truly do believe no matter where our kids go, if you instill that in them
Yep.
in birth, they will revert back once they get too uncomfortable or things get too out of
Yes.
hand. They want to come back
Yes.
where it all started.
You bring up a really good point. It's a delicate balance, right? It's not just allowing them, or not allowing, but creating a safe environment for them to see the reality of the world, right? To see what's going on. But then the other part of that is also having those difficult conversations with them about the things that they see, and what do you do if you're faced with these things and mom isn't around or dad isn't around or sister isn't around, right? So you got to teach them those skills. And I think that's what you're getting at, right? A lot of the kids these days, they aren't given the skills. So then when they become teenagers, they become adults, they don't have the life skills. I'm about to date myself again. In middle school or high school, one of them, we had a class called life skills.
We did.
Now they didn't teach us some of the life skills that I think we should have been taught, like money management and debt. And, there's other options to careers besides going into debt and going to college. That's a whole nother thing. But there, we had that class where you learned how to cook.
Yeah.
It was called home ec. Oh my goodness. Woo. And then they taught you how to do laundry,
so
there was just all these skills that we were taught, right? And these kids aren't necessarily taught them.
And not to drag it on too long, but I feel like they teach us to always work for somebody else. They didn't teach us to be entrepreneurs. And I feel like they surface taught us.
Yeah.
They should have taught us, like you said, financial debt, literacy, and those type of things, because that's what we need in the world. All that stuff that we learned, okay, yeah, but this is what we need to actually make it in the world. So a lot of us didn't learn until later.
Yeah.
We had to mess up first and then learn.
Yeah. And I'll tell you this too, because I know there's a lot of conversations around everybody needs to go into entrepreneurship and things like that.
No.
I say do what works for you. But what's good for the goose is not good for the gander, right? For some people, entrepreneurship fits their lifestyle. Go for it. For some people, they need an 8 to 4:30 Monday through Friday, no Saturdays to Sundays, and they know how much their paycheck will be every week.
Yes.
But either way, to your point, the skills piece, right? There's a component that a lot of these kids aren't getting now.
And even the grown adults, they're not real with themselves. You understand what I'm saying? So like if you are an entrepreneur, right? And I'm working my 9 to 5, but I want to do it because what you doing just seems so glamorous. But we don't know that we're still working to pay our business. We don't know that we only got like a couple of dollars in our banking account because we had to fund this over here and pay bills and do all of this. They don't see us up all night after doing for the kids and doing for the husband, whoever else we're doing stuff for. Like being an entrepreneur is very stressful, and you have to be very strong, and you have to have time management, organization, and all those things. And you have to find time to rest so you don't fall off the bandwagon.
Absolutely.
And people think like, oh, it's entrepreneur, it didn't work till it's meant. No, that's not what that means. So everybody is not meant to be an entrepreneur, and it's okay if you're not an entrepreneur.
I'm gonna go see my patients from 8 to 4:30 Monday through Friday. That's what's good for me right now.
And a lot of these kids want it too, and adults want it because I don't want to work for nobody. I don't want nobody to tell you what to do. Well, let me tell you something. Uncle Sam will always and forever be over you.
He gonna tell you
The
what to
rules and
do.
regulations will always and forever be over you. So no
Absolutely.
matter what you do in this world, somebody is still
Yes.
controlling you in a sense. You cannot just run your business how you see fit.
Absolutely.
You got to meet deadlines, keep license up to date, all types of stuff that
All
you have to
types of
do. So you're never gonna not be told what to do.
Absolutely.
And that be people main reasons of being an
Absolutely.
entrepreneur.
You
I
got to
just
be
like,
informed. Like we've been talking about since the beginning. You gotta have all the information to make a good decision.
and some entrepreneurs got to continue to keep up their education.
Yep. It's not easy.
Oof. Anyway, I don't know. Like I just be like
It's a
talking
lot.
talking to adults sometimes is worse talking to kids.
Yeah, it can be.
I'm like, do you hear yourself talking?
That's what you gotta stop
And
listening.
things don't happen overnight.
Mm-mm.
It takes people sometimes 10 years to pop out on a 15th year
Yep.
and be like glamorous.
Yep.
People
Hard
don't
work.
understand that. I'm not moving. It's not moving too fast. So you done spent all your time
Yep.
and all your money and you just gonna quit.
Yep.
But that's a different time for a different episode.
Look, we got like a running list of things that we gonna talk about.
I promise. Oh my God. Okay, so how do social economics factor and affect access to fertility treatments and autoimmune disease management for individuals facing both challenges,
Yeah.
AI and art?
Yes. Okay. So, kind of let's go back to how I said how people can even get to the point of art, which is assisted reproductive technology, right? You got to start trying and then you have to go see your OB-GYN provider. That's making a huge assumption that somebody has healthcare coverage. That's the framework right there. We're assuming that someone has health coverage and then they have coverage and they don't have a copay that they can't afford. So access to healthcare can be a significant issue for someone who has an autoimmune disorder because getting treatment for that in itself is expensive.
It is.
Even with good healthcare coverage, right? There's still medications you have to pay for, lab work that you have to do regularly if you have to go to the emergency room or urgent care because of flare ups. So, that in itself is a financial responsibility that someone is already contending with.
Absolutely.
So, let's hold that. So, you got to have a pot of money, right? Every month for possibly any crises that you may have regarding to your condition, and then medication, being able to afford that, because once you stop taking medication your symptoms are going to increase, right? And now you're going to be in the hospital. If you're in the hospital you can't work, and if you can't work you don't have health insurance. So it's a
revolving door.
It's a revolving door. So best case scenario, someone does have healthcare coverage. They're able to go see their OB-GYN doctor. They have, some extra money on reserve to possibly do some hormonal treatments or things to kind of address the difficulty conceiving. At that point, once the OB-GYN doctor has done all that they can do for you, they're going to refer you to a specialist, the reproductive endocrinologist. Keyword, they're a specialist.
Mm-hmm.
With any specialty care comes another additional cost.
Yes, it does.
And so one of the significant barriers to people proceeding with even fertility evaluation. So we're not even talking about someone's doing IVF, IUI. They're not doing anything. They're just trying to go and sit with the doctor that specializes in fertility and explain to them what's been going on. That's going to be a cost. After you sit with that reproductive endocrinologist, they're going to order lab work for you and your partner.
So he has to have it as well if you're not married.
Or her.
Or her.
Or they. So y'all got to have insurance because they're going to want to evaluate both of you all to determine if the infertility is due to female factor or male factor. So that includes labs. That can include doing an ultrasound. That can include any additional medical exploration things to, look at your uterus lining, your fallopian tubes to see if there's any blockage, look at your endometrium, look at your ovaries, look at how many follicles you have on your ovaries.
A lot of tests.
And with tests come money.
In different days. So you can't have everything done in one day.
And you can't have everything done in one day. So again, when we kind of think about this financial or the socioeconomic aspect, most fertility clinics are open during normal business hours. Most of us work normal business hours. So assuming that you can afford to come see the fertility specialist, it's also assuming that you have PTO or sick time that you can use to step away from work. Or if you don't have PTO or sick time, it's assuming that missing a couple hours of work ain't no problem. Grist for the meal. You don't need that money. Right? So there's a lot that comes with the financial aspect. So let's say, again, best case scenario, someone has coverage, they have sick time. They get to the point where the doctor says, okay, we think your best chance for success is IVF. Depending on what clinic you're being seen at, the amount of medications that you'll need for your IVF cycle, you could easily be looking at $10,000 to $20,000 for one IVF cycle.
Mhm.
And there is no guarantee that the cycle will be successful. And successful is, it has multiple terms as it relates to IVF. So one kind of form of success that people think about with IVF is there's actual eggs that are retrieved. So they can never guarantee, okay, you're going to have X amount of eggs.
Mhm.
Once the eggs are retrieved and then sperm is used to create those embryos, right? Because embryos and eggs are not the same thing. Then you have to see if embryos are created with those eggs and that sperm. Then you have to wait 3 days to see if those embryos are maturing, meaning the quality and the development of them are in which that would indicate in about at day 5, you can freeze them and you can use them for a later date.
So wow.
Then if you get to day 5, you have embryos that are of quality to use. There's also something called genetic testing. So then you can choose to test these embryos for any medical conditions that may indicate that it would not lead to a live birth.
Mm. It's an extra cost.
Yeah. That's extra cost too. The genetic testing is an extra cost. And then if you say, okay, you got, let's say, 5 good embryos, now you have to freeze them. Well, there's a cost to store the embryos. That's not free either. And then once you decide you're going to do an embryo transfer, you have to go through another round of medications to get your body prepared for this embryo transfer. You got to go back and see that specialist, and you got to do that transfer. And then you got to take medications after the transfer in order to kind of help your body help your body hold on to that embryo, or what we call implantation.
That is a lot
of money.
Of money, time, effort, and everything. Mm-hmm. And for it not to work, that can cause somebody to do more than crash out. Mm-hmm. People probably have their houses up, second mortgages.
I've seen it all. Credit card debt, personal loans, borrowing money from family members, taking on a second job. So like, for example, Starbucks has really good fertility coverage.
They do. Listen, I only know about that because I go to Starbucks all the time, right? So I was in a driveway and I see like a lot of older people right there. And I'm like, how's the benefits here? So that's the first thing they have amazing benefits. And I'm like, really? Starbucks? Yeah.
I have couples who have professional jobs who then go get a part-time job at Starbucks to cover their fertility treatment.
That is amazing, because that means somewhere in the mission statement or whoever owns the company believes in that so much that they are paying into that.
But it's also sad. Like, why should somebody have to get another job? Not for the pay, but for the healthcare benefits.
A lot of them don't cover that.
No,
at all.
very minimal coverage. But yeah, Starbucks is a place. There are some stipulations, like you have to work X amount of hours a week and you have to be there for a certain period of time before you have that benefit. But yeah, so this is very expensive, going from, trying to all the way up until you have, if it's a live birth or not.
So these people that you see, do they already have a child or they're without children?
I see the whole gamut.
Really?
Mhm.
People that have children go.
Yes.
Now that's
And that's probably a whole nother episode.
yeah.
We can
You
talk
know, just put a
about
pause on that, like-
the emotional aspect of conceiving naturally once and then wanting to conceive naturally again with the same partner or a different partner and having a hard time doing that. That's a whole different emotional experience.
Yeah, you guys are definitely needed. Because just going through my brain, I'm just like, this is a lot.
Yes,
This
it
is a
is.
lot.
It's a lot.
Okay. What are the long-term health implications for both mother and child following a pregnancy application by an autoimmune disease?
Yeah. So kind of like how we were talking before about like I'm not a physician per se.
Mhm.
Well, I'm not a physician. I am a doctor, a psychologist. So
I love how you say that. I am not.
yeah, because I have to spell because
You
people
see
will be
that
like,
on movies a lot.
yeah, people be like, you a doctor, asking me for medical advice. I'm like, I don't know. But I would say, what I can just kind of generally say,
Mhm.
right, is anything that you are taking during your pregnancy can't impact baby.
Yeah, I know that, right?
Right.
Why do people say that they don't? Why do people think it is okay to smoke marijuana and
Mhm.
cigarettes and all these other things
Mhm.
while they're pregnant
Mhm.
and think nothing is going to happen to their child?
So I can't answer that why because I don't I don't
That's just the dumbest
I,
thing ever.
I think that right when we look at the core of substance use,
Mhm.
it is masking or covering up something.
Let's see what you got to do when you're pregnant.
So, and I work with moms who are using substances during pregnancy,
With the IV?
like during IVF, IUI, or while pregnant. So part of my job is working with people going through the fertility treatments, and the other half of my job is working with patients who are pregnant.
Oh, wow.
So I see the full experience. And there's a lot of shame and stigma around substance use during pregnancy. But when you look at the root of it, right, kind of the underlying cause of substance use in general,
Mhm.
especially during pregnancy, is that you're trying to cope with something that's really, really hard to cope with. Rather that's depression, anxiety, trauma, being in an abusive relationship, financial strain. People use substances to feel better.
Yeah, but it doesn't always make you feel better. And then,
Mhm.
too, like, since you work with them, have you ever told someone, like, before you can, try to start having a child, you might want to go see a psychologist or a therapist because your mindset has to be right
Mhm.
first. It
Mhm.
should be.
Should, but not everybody feels that way. Or I shouldn't say not everybody feels that way. What you may consider healthy or doing well, someone else may not. It's very subjective. I know it's hard to accept. It's very subjective. Kind of
I'm trying to keep it.
it's subjective, right? So remember, I think even before we kind of came on live, we were talking about, you know, depending on what you're around,
Yeah.
what you see, that can normalize behaviors that someone else may not consider to be normal.
True. I get that part.
So if you are in a family where you saw women in your family drinking and smoking and partying during their pregnancy, there is the possibility that for you, that is a normal thing.
So let me ask you something, because I was just talking about this to someone.
Mm-hmm.
We see it, we grow up with it, right?
Mm-hmm.
You have to know. I feel like they know that it's wrong, but because they feel like the kids are okay, they do it. Because what part of your brain doesn't understand that you're not supposed to be drinking and smoking with this child, right? So is it because they didn't see anything bad happen to the kids that they have?
Could be.
Because I know they don't think that that's okay.
Interestingly, the women that I do work with that are pregnant and using substances, they are well aware that this can have an impact on their baby. They're well aware that it can have an impact on them. But when we look at addiction, right, as a whole, it is a medical disease.
It is.
That requires treatment. It has to be treated. And not everyone wants to treat it. So I'll give you another example. I see.
Wait, but that's what I was looking for. Because I specifically said people. Okay, we're gonna get back to this, but people sit up there and say they like mental health is so big, right? But it really is big. But mental health is so big to where it's people that's playing on the mental health, saying that I don't have the mental capacity, or just I feel like over expressing it when it's really not that. And I feel like sometimes when people say trauma or trigger, it's not really that. I feel like those people, if it is trauma, they don't want to deal with it because they can talk about it every day and all day, and it's like, what are you gonna do about it? Right. So I feel like those people don't want to deal with it because that excuses them to behave however they need to behave.
It can, right? So some people may use it as an excuse. I think, from the outside looking in, we have to be careful, right? Because we see somebody's situation from our lens, from what our lived experiences are, what our beliefs are, what our values are, what we think people should and should not be doing. Similarly, people can look at us and have their viewpoints about our lives and what we should or should not be doing, how we should or should not be doing something, what it should or should not look like. But I think to the point with like addiction and even trauma, even anxiety and depression, all those are medical diagnoses because it does change the chemical imbalance in your body and it alters the neurotransmitters in our brain. So witnessing a traumatic event can alter your brain.
For sure.
And it can prevent you from doing things that you need to do, even when you know you need to do them.
See, that's the problem that I don't know if it's a problem, but that's kind of like how you talk to somebody, you talk to them and it's like, you need to, but then you're so strong in other areas. And it's like, well, why are you not trying to get help in this area?
Because that's their growth area. They don't want to. Not right now. They don't want to. They don't know how to. They're scared to. They don't have the support to. I always tell my patients, coming to therapy is huge.
It is.
If you can just come and get here, we can. I kid you not. I've had this conversation with some of my women. If you want to talk about different wigs for 30 minutes, because that can be therapeutic because you're learning a social skill, how to connect and communicate with somebody, how to find common interests with another person. That's a skill set you're struggling with. Just come on and bring some pictures. So we can talk about the wig.
I love it. I love it.
So you never know where people are starting from. You never know how far they've come. We just kind of see people for where they are in that moment.
Yeah.
So you have to you have to be careful. You could definitely say, oh, I don't think that's a healthy way of having a pregnancy, but you don't know what that person is going through.
You don't know what that person is going through. And I'm not judgmental at all. However, it's not the pregnancy, but it's just one of those things when you having friends, for example, just let's say I'm having you, my friend, and you have anxiety, right? But then I see you flourish in some areas, but then in other areas you can't flourish, but then you put it off on other people because how they make you feel. But I see different because you can't take how they're talking and you let that affect your emotions. So that breaks you all the way down. And now we got to start from scratch A. So then if I try to communicate that with you, you're not listening to me.
She ain't got to though, sis.
She don't, right? But I don't want to keep listening to the same thing.
Listen to her. That's a whole nother conversation for another day. If you don't like to hear it, stop listening to it. Sis, I love you. I don't have the capacity to hear that no more. We've been talking about the same thing for 3 years. We've been talking about that same man for 3 years. We've been talking about that same job for 3 years. I can't listen to it no more. When you're ready to make some steps towards changing, call me. Until then, I'm praying for you.
And that's what I said. Some people don't want to get help.
That's fine.
And I'm not talking about anybody specific, you
Right.
guys. I'm just
In
scenario.
general, that's fine.
Yeah.
People ain't got to get help.
You funny. I love that.
I tell my friends, you don't have to come see me. You don't have to get help.
You tell them that?
Yeah, this is voluntary.
What they say?
No, like if somebody is going back and forth about, well, do I come see you? Do I not see you? Do I come back and see you? Do I not see you? Hey, healing is for you to decide what that looks like.
Absolutely.
I am just one layer of support that you have access to.
Absolutely. I feel like everybody needs therapy.
Mm-hmm.
I love therapy.
It's great.
I used to be so happy on Wednesdays to see him.
Yes.
Can I get 2 days a week?
Right. Yeah, therapy can be a very positive experience if you are connected with the right. You got to find the right fit.
You do.
And if you're ready to do the work.
Yeah, and sometimes for me at least, when I'm sitting there and just ranting or talking to whatever it is that I'm doing, I'm like, I just answer my own question.
Yeah.
Like I just answer my own questions. Like, you understand? So I love therapy. Like, I think everybody should get it. We all go through something.
Yeah. I even tell my patients, you can come to therapy because life is going well.
I can see how that can be, because I tell people all the time, being successful is lonely. Being successful is lonely, and it's regret sometimes, because you feel like the people that you want to be with you is not here, and they think you acting funny and all this little extra stuff. Like, so I totally get that. And I also think that when people, like get signed and get all this money, I feel like it should be therapists available to them, because money causes a lot of those things that they go through.
It can. But even if it's, life is about transitions.
It is.
When good things are happening, those are still transitions. And sometimes you need an unbiased perspective for someone to give you another way of looking at that really positive transition. Like I do see women who are, having a hard time getting pregnant. I see women who are in their pregnancy and it's going great, and they just want to just talk about how their life is changing. The beautiful parts of it.
That's dope.
Therapy don't have to be because me and my mama not getting along. I don't like my husband. My kid don't like me. The church people don't like me. I don't like me. Dog don't like me, right? It doesn't have to be because something is wrong. Now, you definitely, if you need some healing, therapy is a great place to go.
I believe so.
But healing doesn't always have to be associated with a negative experience. Healing can be being comfortable in experiencing joy.
Yeah, or finding yourself.
So many of us are uncomfortable with joy and happiness because we're so used to the bad things.
Yep. We got one last question, even though it's not the last question, but we know you got to go.
Okay. One last question.
How can we improve the integrity of rheumatology and other specialists care for individuals with autoimmune disease during pregnancy and postpartum?
Yeah. So I think it goes back to that humanity piece, right? It's the science.
I love how you got
and
to
the
connect
art.
the dots.
Yep, you got to connect to that. So it's the science, right? So treating the illness, that's just a science, right?
Yep.
But then there's the humanity piece. So when someone is living with a chronic health condition, that can be really dehumanizing. Sometimes people can feel like they are everything. The only thing that they are is their diagnosis, because it consumes so much of their time.
Absolutely.
And so, I think medicine is doing a really great job in that their hospitals and medical schools are hiring psychologists like me that can help train medical providers to bring that humanity in. When you look at the training of medical doctors, they're not trained as therapists. They're not trained as social workers. They are trained to treat an illness.
Absolutely.
And so I think continuing that, right, having people like me and other mental health providers who can help train, who can help consult, with physicians on the emotional aspects. I try to be very intentional about making sure that I'm having community conversations with my community, with my, medicine peers about how you can integrate humanity into medicine. And it can just be the slightest thing. So I'll give you an example. And we can leave here. I sometimes I've had to tell colleagues like, hey, did you realize your tone was kind of like, ooh, when you was talking to that patient? And oftentimes they're like, no, I didn't realize that. I was just rushing. I'm 20 minutes behind. I'm just da, 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 da. I'm like, yeah, that just sounded a little bit harsh. Put a little sweetness on it, right? Just talk. What India Irie say? Talk to her like you talk to your mama. Just just be a little sweet, right? Be nice and see the humanity. This is a person, right, who is living with a very difficult diagnosis. So I think that's like what we can continue to do, and we're doing it. I think we're making progress. There's always room for improvement,
Absolutely,
but we are making that progress, and we recognize that it's needed.
It definitely is needed, and I do probably, I not probably, I do want to say, because when I was a floor nurse, they hold you to certain times, and if you don't meet those times,
Yeah.
I'm just like, you basically getting dinged.
Yep.
It's a problem on the floor. You know what I'm saying? So upper management put the pressure with the people that's on the floor that's seeing these patients to be like in and out, and that's not how you're supposed to do that. The patients are supposed to feel like you care for them, you have the time for them. That's why I would love my doctors at Freighter, but you're trained to be like that. So it's definitely good to have you come in to break that bridge, because a lot of those things go wrong when the upper management like, why this happened, or why this didn't get done, or the families come in and complain. It's because you have this person on a time limit.
It's a lot of pressure. My physician colleagues, nurses, they're under a lot of pressure to meet those numbers, make sure that people are getting what they need in a timely manner. But again, I still believe it's the small interactions. Like I use the example today where the approach that I use is any interaction that I have with the patient is therapeutic, no matter how long, how short. So like, the patient walk past the room. Hey, Erica. Hey, you doing all right? How's your dog? Your dog good? All right. Okay. And then, that type of stuff sticks with people.
Yeah. Because you remember my dog.
You remember my dog. Or, even if whatever, you don't even have to go into all of that, but just kindness. Remember that we're all human. We're all going through stuff.
Absolutely. So before we leave, what all do you have coming up in the community?
Oh, what do I have coming up? I know in July, I am a panelist on the Proud Black Girl Conference here in Milwaukee.
Okay.
We doing something in May, aren't we? Am I doing something with you in May?
You are.
May 3rd.
Yes.
I just can't remember what it was. But I told you I was gonna do it.
The 5th annual Lupus information.
Yes. That. And probably more to come, to be determined.
I love it. I love it. We are definitely going to drop her tags in there.
Yes.
Please be on the lookout for her tags.
Yes.
Keep up with all that she has going on in the community. It was so good having you. You are so full of all of energy. You are dope. I love the way you explain things for the people that don't understand the medical terminology.
It's confusing.
You spoke to everybody. I'm sure somebody is going to look at this and learn from it. So thank you so much for coming on this platform.
Of course.
We are live every Wednesday at 6:30 at Lupus Has No Face podcast with your wonderful host, Savannah. And till next time, see you soon.
Bye.